Muscles protect nerves. You see what I'm feeling for, Wendy? Are you able to tell? There we go, and back off. Wendy is subtle to assess, but I can feel it, and I will now get Wendy to also test it for herself. Your fingertips, please, Wendy, come back here. And now I've got your neural structures on. I'm going to ask you to see if you can sense, bang, they switched on, and then they're off. And when this is off, it goes further, bang, they're on, and off. Was it subtle, but was it still perceptible? Okay, so you can still help me test. Now I'll show Wendy, when it's on, you only have that much knee extension.
Oh, okay.
Yeah, you know how much you should have if it was in good shape? Nearly straight. So we can say your nerves are being protected at the moment. And if I take your nerve tension off, you go some further. What made it positive? Sensitization made it positive. So we just use the sensitization to say whether you're positive or not, because when we sensitize, you lack another 15 degrees range compared to if we don't sensitize. So I will show you treatment of a neural interface developed by Bob Elvey and my modification of that. And in 90% of people, we will fix up and clear nerves in a very short period of time, just like it has happened right here.
Okay.
So how do you do this? We're in the test position. Comfortable so there's no reactivity. And then we grab hold of the ilium, and I will put the ilium against my rib cage so that I have very good, steady control, so I don't get a tired arm. I need my body to control this with my legs. And I'm going to do lateral flexion away. I stop at R1, and I go back to neutral. Very different to typical physiomobilization. You should feel like I'm doing nothing. And a lot of clients say, when are you going to start? I'm like, I've been doing it for a minute, but they should not feel much at all. It's very specific, very sensitive, and in the time you've seen me treat, it's already fixed her neural dynamics. So Wendy, let me take you through it again.
Sure.
So on your ilium, body weight. Now my trunk also rests against the thigh as well, just because it's this is the sort of position I'm getting in. This hand does nothing but just palpate, testing, lumbar erector spinae, quadratus lumborum for R1. This hand is not putting any force anywhere, just palpation. Then I rock my body to do lateral flexion, and boop, R1. The muscle tense, so I stop, and I go back. 1001, 1002. 1001, 1002. I'm giving you the indication that it's a very slow mode. It's not. So you can count in your own head just to keep slow. Each repetition, when you're doing it well, you'll find, oh, I go a bit further. Now there's R1. Slowly back. Go again. Oh, go a bit further. Now there's R1. Do you get what I mean? So it's actually loosening up just with one rep at a time. So that's what it was like when I did on Wendy.
Yeah. How many repetitions?
Until you plateau.
Okay. Okay.
Some people plateau after 5. Some people plateau after 5 minutes. It's all based on how the client responds.
Right.
Then we retest to see if it's helping. So we retest, and we just say, guess what? Wendy, you have your leg out pretty much straight, and that's same,
Okay.
nerve on or nerve off. I took a photo so that Wendy can see it herself as well. But I would then say, you need your own proof. Don't believe me. Yes, thank you. So, are you able to sense that I can go this far out until that starts to tense. And are you able to sense that's a big difference from
Sure.
before? Okay, good. What if your client had upper cervical as positive? So now we're going to do a technique in the upper cervical spine that is short of R1. I will start with the straightforward one to get going with, and that is just repeat CO1 flexion, short of R1. Just repeat it, repeat it, repeat it, and get more range until it loosens up. But just resting right there. Now, I demonstrated upper cervical flexion before with my whole arm like this, so that I can get very sensitive, because I'm using my shoulder, I'm using my arm, and I have my fingertips free to assist or sense how that's going. Yes? So I'll do this technique, and I'll say, oh, there's some R1, the muscles guard in the neck, stop, and back off. 1, 1,000, 2, 1,000, oh, there's some R1, back off. Repeat, until it plateaus. All right, after that, now I ask you to sensitize again, please, Wendy. And then I repeat, and I go, hey, wow, full range, no resistance. And now leg down, and, well, same, full range, no resistance. So now no difference. So now it's negative. What about a progression? How about you're getting better, but it's still a little bit of positive? So you'd hold like this, and then I'd repeat the treatment. Short of R1. If you put a chair up there and Wendy lifts her leg on a chair, you know, with a pillow on it, so you don't get tired and strain your back.
Yeah.
So that's the treatment and progression of upper cervical spine until you get neural clear. The main principle is treat short of R1 and go back to neutral each time, whichever techniques you have. No provocation techniques. No PAs which cause provocation and guarding. So we'll just say that one's positive. So we're going to now do some upper limb treatment. I will demonstrate as if that one's positive so you can see what I'm doing. We're going to grab the cervical vertebrae at the level that is most reactive. How would we know which one's most reactive? We'll just do a couple and see, and I'll show you. So let me just make sure I don't put your hair again. Let me just sort of lift it. Yeah, that's it. How's that? Okay. So I now got a grip around C7, and I'm doing a lateral glide. And I'm doing that with my body. And I do that where I block the head and block the vertebrae. So everything above that level is all one. It's all blocked as one in my grip. Very relaxed, no reactivity. Very, yes? So then I do that on C5, C4, C3, C2. Oh, guess what? C5 is the one with the less range before R1 kicks in. So it's the most reactive. So that's the one I will treat first, try first. And I'll be in this technique, gripping the vertebrae from side to side of its transverse process, blocking the neck all above, sensing with my fingertips. If this side was positive, I'm going to do lateral flexion away first as a choice. If it doesn't work, you can try towards, but we'll try away first. Very imperceptible movements for some people. 0.5 millimeter. The client won't even know you're doing anything for some people until R1 kicks in. That's it for Wendy. I've just done one. 1,000, 2, 1,000, 1,000, 2, 1,000, 1,000, 2, 1,000. Can you really slow? Now you will have trouble seeing what I'm doing. I'm not really doing much, right? But then as the amplitude increases, before you hit R1, it will become a bigger movement. And that's about as big as it gets. That's as big as you need. I hope I'm all right there.
Got it.
Lateral glide away. No physiological movements in this one. No lateral flexion, no rotation. Neural interface is best achieved when it's very specific and localized without any other movements.
Where is the movement from? Is it from your trunk or is it from your arm?
Legs and trunk, thank you. So if I blocked it, I'll do the movement like this.
Yeah. Also until the plateau.
Also until the plateau. And then when it plateaus, I would be on that side and I would check your range again until we see how far you go until the reactivity kicks in.
Yeah.
And then most people within a short period of time would have all the way without any reactivity.
Yeah, but for this one, you also have progression like that, right?
There you go, thank you.
Okay.
So if you're plateauing and you test and it's still positive, but just a little bit of positive, but it's plateauing. So then you just ask the client to hold that position, or you put the bed against the wall so that their hand rests on the wall, rest that there, and that's the progression. And then you repeat the same like this. Now, if your arms are long enough, you can grip the client with your arm, put in position, bend your elbow for me, let it go floppy, that's it, I've got you. And I will hold the position and repeat the movement. How's that? And then I can just go to R1, whoops, bit of R1, so I back off. Oh, and then, hey, it's progressing, hey, and then it plateaus. Oh, there it plateaus. Hey, look at that, I can go all the way out straight and also do a glide. The chances are that's okay. You can do a test and it will be negative.
Yeah.
Thank you, good point. Thanks, mate.